Hello and welcome to Let's Talk Climate, a webcast series from ecoAmerica, featuring dynamic discussions with local and national leaders offering diverse perspectives. Let's Talk Climate brings forth the latest thinking and best practices for building public support and political resolve for equitable climate solutions in the U.S. I'm Rebecca Rear, Director of the Climate for Health program at ecoAmerica, joining you from Nacotchtank and Piscataway land to talk about climate action for women's health and better birth outcomes. I'm joined by Dr. Santosh Pandipati, Director of Maternal-Fetal Medicine at O'Connor Hospital. Hi, Santosh.
Hello.
And Dr. Tracey Woodruff, Director of the Program on Reproductive Health and the Environment at the University of California, San Francisco. Hi, Tracey.
Hello.
Thank you both so much for being here. You're both authors of a very recent publication in the International Journal of Gynecology and Obstetrics, which is called Climate Change, Women's Health, and the Role of Obstetricians and Gynecologists in Leadership. So can we just jump in? What are the core messages and findings in this article? Tracey, let's start with you.
Well, first I want to say it's great to work with Santosh, and this is a really important publication because the organization FIGO represents hundreds of thousands of OBGYN and women's healthcare professionals around the globe from over 130 countries. So that's why I am just so excited to be a part of this. And what's really also important is it's kind of the first time that this group of health professionals are saying this is not just an environmental crisis, it's also a public health and social justice crisis. And it disproportionately affects certain groups of people, including pregnant people, children, marginalized communities, communities of color, including Black, Brown, and Indigenous communities. So that I think is it's really phenomenal to have this voice of leaders representing women's health talking about this. And I'm going to turn over to Santosh, who can talk about some of the aspects, but I'm looking forward to also talking about some of the recommendations.
Thank you, Tracey, and thank you, Rebecca. I want to thank you, Rebecca, for providing this opportunity. Tracey, it's been an absolute joy getting to know you over the last year, working on this publication together, looking forward to future work together. I think from a practicing community maternal-fetal medicine specialist, this is the first time that really a message has been directed to the women's healthcare community by frankly, experts, more expertise than myself in this field, like Tracey. But this is where we as healthcare providers really need to start waking up to understanding that climate change is not esoteric. It doesn't exist just in Glasgow. It actually exists everywhere that we live, and it's affecting our patients today. As a practitioner in the Bay Area of California, similar to Tracey, we have felt the impacts of climate change quite palpably over the last few years, and it's accelerating. And so I think this is very apropos to be having this conversation. And as Tracey mentioned, we're kind of at the tip of the spear in terms of patients who are going to be affected. We take care of patients as women's healthcare providers who are among the most vulnerable groups. So I would love to get into some of the details, but this is very important from a bread and butter, day in, day out, individual clinician to patient-provider relationship. There's a lot that we can do.
Yeah, I appreciate that. And I saw a video this morning from health professionals that said in part, we are losing our patients to climate change, and we are losing our patients with leaders. And I think that really sort of to jump into the solutions that Tracey alluded to, right? Along with the article, the International Federation of Gynecology and Obstetrics, or FIGO, which you mentioned, has called for governments around the globe to implement policies that address the root causes of climate change, including fossil fuel production, as the only way to minimize the impact of climate change on the health of women and girls. This is really important, as you mentioned, and exciting institutional leadership. So what is your advice to folks looking to engage their organizations in this work? So Santosh, why don't you pick up where you left off?
Oh, sure. It starts, I really work at the grassroots level, right? So in terms of the grassroots for physicians is when they're interacting with patients day in and day out, and also with their local community of providers, serving on the hospitals and referral patterns that we have and educating our community. It starts there. And when I start talking to patients about, hey, you have to watch the air quality index. Hey, this is wildfire season. You need to be vigilant about this. You need to be watching heat, especially early in the warm season. We start to worry about that, right? Flash floods and, flooding. And what does that mean? Power outages that affect access to care. These are not just in low and moderate income nations. This is now affecting the United States as well in a Silicon Valley. So when I start talking to patients about these things, they start to understand, my goodness, climate change is not actually something out there in a political blogosphere. This is actually affecting my family here and now. The light bulbs start to go off, and it's no longer about politics, but it's about doing the right thing, and it's about protecting lives, and it's about, what do I do to keep my family safe? When we talk to other healthcare providers and we say, look, we work so hard, especially in high risk obstetrics, to lower risk for preterm birth, to lower risk for fetal growth restriction, to lower risk for pregnancy complications. And yet, despite all of this, we are then confronted with environmental catastrophes that negate all of our strong efforts at trying to mitigate these risks. It almost makes it kind of like, wait a minute, we're ignoring the more serious problems that are existing. And so the root cause is where, once there's awareness, now we can ask for those solutions, those root cause solutions, which are really greater than any individual provider or patient, right? So I'd love to hear Tracey's point of view on this, because I think there's a lot institutionally that can be done.
Right. This is why I think this statement is so exciting. And so I just want to note that one of the authors of the report is Dr. Jeannie Connery, who's the incoming president of FIGO, and Dr. Linda Judice, who's the former chair of OBGYN here at UCSF. And the statement, as you mentioned, Rebecca, is calling for systemic solutions, because as Santosh said, we live in California. There's wildfires, extreme wildfires that have happened because of climate change, and that we're exposed to these really extremely high levels of particulate matter air pollution, which can affect fetal health. And so we can do some individual things, but really we need system-wide solutions to deal with the causes of climate change. And this is where the FIGO statement is so important, because it directly talks about government-based solutions, that government leaders around the world need to address this, and they have to address the role of fossil fuel consumption as a contributor to climate change. And just one more thing I want to add, I think that's also unique about this document, is it talked about the link between fossil fuel production and toxic chemical exposures, because the same source also produces many of these industrial toxic chemicals like perfluorinated chemicals, phthalates, et cetera, that pregnant women are also exposed to and can adversely influence their pregnancy and child health. So it's really amazing to work with leaders like Santosh, who are recognizing how important it is to be engaged on behalf of their patients and working with their patients and being able to talk and educate their patients and then contribute to global solutions.
Yeah, I really appreciate that personal, that human, that our family connection that we're able to make with these impacts on climate change, because climate change really was introduced to us as polar bears and ice caps, right? And first impressions really do mean a lot. And although no shade
to the polar bears, we do feel bad for them too, right?
No, but I've yet to meet a polar bear, but I've met lots of humans. And I do think it's important that we talk about this human impact, right? And so I appreciate you really bringing that forward, and bringing that forward in your work, not just here in this conversation, but bringing it forward in your daily work, and sort of, being a model for other physicians to follow it with their patients. It's really, thank you for the work that you're doing. So, and what I want to ask you about to wrap up is about mental health. So we just published the 2021 edition of Mental Health in Our Changing Climate with the American Psychological Association, which did outline particular risks to women, children, and young adults from climate change. And so I want to ask, how are you managing stress in pregnant women about climate impacts, while giving them solutions? And how do you care for your mental health as you endeavor in this critical work? Tracey, do you want to kick us off?
Well, I think I'm going to start with Santosh, and then I'll follow up, because I have some additional because sometimes you talk to people, I would be very interested to hear this. And
Sure.
then I would happy to follow up with that.
Yeah, thank you. And just to close the previous, I mean, Tracey and her colleagues, Linda, she's mentioned, have done tremendous amount of research bringing attention to this problem. And where we're at is not a lack of research. It's a lack of dispersing that information and really activating people, right? And so this is where it takes both. And I'm so honored and proud to work with people like Tracey who've worked so hard to bring this information to the public, right? So when we're talking about climate, it's easy to get despondent. Now, mental health effects of climate change, right, are largely secondary to climatic events, right? So power goes out, or you've got heat stress, or you've got to essentially abandon your home because of wildfires when you're pregnant, or you have young kids. These are very clearly associated with significant adverse mental health effects, PTSD, depression, anxiety disorders, et cetera. These are very legitimately known. It's been studied after natural disasters like Hurricane Sandy, Hurricane Katrina, and others. There's higher rates of violence against women and children in these times of stress. So we already know that there are significant mental health impacts. And so when we're taking care of patients, we have to be understanding of the social determinants of health and how is that impacting how is that going to impact the well-being as a pregnancy provider for that unborn baby and the overall family. As far as ourselves, I mean, look, we can't lose hope, right? We have time. And there's not only mitigation, but there's adaptation, right? We throw these words around. How do we get our patients to be more resilient to climate change, right? And so some of it we do have some control over, paying attention to things that you would have never paid attention to before in terms of heat exposure, hydration, particulate exposures, et cetera. This is what we can do to arm patients to say, how do you stay resilient right now? There are big changes happening. How do you help figure out solutions systematically? Well, one, by doing things like what Figo's saying. For some people, they could look at that and say, well, what's another statement out there? Well, I think healthcare providers are waking up to this, and they're understanding that this really is impacting health. And climate change is not just an environmental problem, it's a human problem. And I started talking about this 18 years ago, and my initial title for my grand rounds at the University of Washington was Challenges to the Survival of the Human Species, not about polar bears, but about human beings. So this is really what we're talking about. I'd love to hear, Tracey, what your suggestions would be.
Well, I have some practical things on the Figo website. And one of the things that Figo has developed is practical tips for people who can do these types of individual actions to prevent the influences of climate change, whether it's about air pollution, heat, et cetera. And the mental health issue is very interesting. We actually at UCSF funded through our Earth Center, Environmental Research and Translation for Health Center, a project by someone in the psychiatry department who also developed a kind of an infographic for the public to, like, what should I do practically about not, when it gets really these heat island effects like we saw in Portland and Seattle, or when we have these extreme wildfire events and we have high levels of air pollution. There are things that we will have to do to adapt to this. But I want to say it's also, we also make sure we talk about that there's a role for advocacy in not everyone's going to be an advocate, but people can be an advocate, or their professional society can be an advocate on their behalf. And that's why this Figo statement's really important. And I agree with Santosh about hope. I mean, the state of California, has had aggressive climate change goals for a number of years, starting in, I think, maybe even in before the Schwarzenegger administration, picked up by Jerry Brown and continuing. And has it been perfect? No. And there is a lot of environmental justice issues in the implementation of that program that have to be addressed. So that's also a really important component of this. But they have made great strides in reducing their reliance on fossil fuel consumption, though of course there's more to go. So I think we can look to, things that have happened in the past and be inspired. And then, I don't know, take a nap. I like to do that. That's helpful too.
Sleep is critical.
I probably should not admit that on a live thing, but whatever, good one.
No, I appreciate both sort of those immediately tangible and practical tips. And I imagine for a pregnant woman or for parents, having those things that are within the sphere of identifying those things which actually are in the sphere of your control is probably a useful in and of itself can reduce stress, which is good. And then getting engaged in the movement, getting engaged in advocacy, holding your elected officials accountable is also feels good. And sort of being part of that movement and finding others who are in, finding those colleagues, finding those folks who are in the movement with you and building community, with folks who are all working on this together can really, lift our spirits and continue to give us hope. So I just thank you both. Thank you, Santosh. Thank you, Tracey, for being here today with us, with all of our listeners, and for your ongoing work and wisdom. From all of us at ecoAmerica and Climate for Health, thank you. Please join me in caring for our climate to care for our health. Stay well, stay safe, get active, and see you next time. Thanks again.
Thank you.
Thank you.